How do you spot surgical wound dehiscence? Imagine having a fresh surgical wound and suddenly noticing something strange. It might be a sign your wound is not healing as it should. Recognizing this early can make a big difference. Wound dehiscence happens when a surgical incision reopens after surgery. It can be partial, where only the outer layers come apart, or complete, exposing deeper tissues or organs. The first thing to look for is if the edges of your wound are pulling apart or separating. Sometimes you might see a gap or a visible opening. Another sign is increased pain around the wound site. If you suddenly feel sharp, ripping, or pulling pain that gets worse, it could mean the wound is reopening. Swelling and redness are also common signs. The area might look puffier than usual, feel tender, or appear inflamed. These symptoms often suggest irritation or infection. Drainage from the wound is another important sign. If you notice more fluid leaking out, especially if it's cloudy, bloody, or has a foul smell, it could be a warning. Sometimes, stitches or staples that hold the wound together might come apart or be missing. If you see this, it might be a sign the wound is not staying closed. Other clues include symptoms of infection like fever, chills, or warmth around the wound. These signs often accompany wound separation and need quick attention. Most cases of wound dehiscence happen within the first week after surgery, especially after abdominal procedures. Factors like coughing, lifting heavy objects, or sudden movements can put strain on the wound. Infection, poor healing, or health issues like diabetes or smoking can also increase the risk. If you notice any of these signs, contact your healthcare provider immediately. Early treatment can prevent more serious complications and help your wound heal properly. To sum up, watch for the wound opening or pulling apart, increased pain, swelling, unusual drainage, and signs of infection. Being aware of these symptoms helps you take quick action and supports your recovery after surgery.